Hey everyone, and welcome to today's Explainer. I am absolutely thrilled you're joining us because today we're tackling a topic that affects millions of people around the world every single year. We're talking about urinary tract infections, or UTIs. Now, you might already know that these are incredibly common bacterial infections, but here is the really good news. They are also highly treatable. The key to that treatment, and honestly to preventing them in the first place, is understanding exactly how this infection happens. So we're going to trace the entire journey of a UTI, from the very first microscopic breach all the way to how we fight back.
Okay, let's dive right into this. Here's our roadmap for today. First, the urinary system explained. Second, the path of infection. Third, symptoms and emergency signs. Fourth, diagnosis and treatment options. And finally, prevention and future health. To truly understand how an invasion happens, we first have to understand the territory being invaded. Section 1, the urinary system explained, your body's filtration network. This beautifully illustrates the normal, perfectly healthy flow of your urinary system. It basically works in 4 distinct steps. First, up at the very top, your kidneys are constantly filtering your blood, maintaining fluid balance, and producing urine. Step 2, that urine travels down 2 little tubes called your ureters. Step 3, it arrives right in the urinary bladder, which just acts as a storage tank. And finally, Step 4, the urethra carries that urine out of the body. Now, I really want you to notice the direction here. Everything flows down and out. This constant outward flow of urine is actually one of your body's most amazing natural defense mechanisms against infection. It literally flushes out intruders.
But, the system isn't perfectly invulnerable. There is a crucial anatomical vulnerability here. UTIs are significantly more common in females than in males. Why is that? Well, it's just simple anatomy. Females have a much shorter urethra, which means bacteria have a significantly shorter distance to travel from the outside of the body to actually reach the bladder.
Now that we know the landscape, let's introduce the antagonist of our explainer. Section 2, the path of infection, from microscopic breach to macro threat. While there are definitely several types of bacteria out there that can cause a UTI, the vast majority of uncomplicated cases have one single primary culprit. We're talking about Escherichia coli, commonly known as E. coli. Now, this bacteria naturally lives in our digestive tract, where it's a perfectly helpful neighbor, but when it wanders into the urinary tract, well, it's in the wrong neighborhood, and it becomes a major problem. Let's actually trace how this infection builds. Remember that downward flushing flow we talked about earlier? The infection is going to fight directly against that current. Step 1, E. coli bacteria enter the urethra. Step 2, they begin to multiply, and fast. By Step 3, they've reached the bladder, causing the lining to become inflamed, and that's a condition called cystitis. Now, if this is left untreated, we hit Step 4, where the bacteria travel up the ureters. This leads to Step 5, a really dangerous kidney infection known as pyelonephritis. And the absolute worst-case scenario is Step 6, the bacteria breach the kidneys entirely and enter the bloodstream, causing urosepsis. And make no mistake, that is a life-threatening medical emergency. But it's important to note that not all infections follow the exact same rules. There is a huge difference between a simple UTI and a complicated one. A simple UTI usually happens in an otherwise healthy person with a normal urinary tract. But a complicated UTI, that involves underlying conditions. For instance, think about a clinical case of an older man with an enlarged prostate. Because the prostate prevents his bladder from emptying completely, that stagnant urine just sits there and becomes a breeding ground for bacteria. This leads to recurrent, complicated UTIs that carry a way higher risk of permanent kidney damage.
So how do you actually know this invasion is happening? Section 3, symptoms and emergency signs, recognizing the clinical fallout.
As the bacteria travel higher up the urinary tract, your body's warning signals change dramatically. If the infection is down in the lower tract, the bladder, you're looking at cystitis. Imagine a young woman experiencing a sharp burning sensation during urination, a constant frantic urge to go to the bathroom, and maybe even cloudy urine. But if those bacteria reach the upper tract, the kidneys, the symptoms shift completely. Now you're dealing with systemic issues, a high fever, severe flank pain in your back or side, nausea and vomiting.
Which brings us to a really critical question we have to pause and ask right now. When exactly does a standard, albeit uncomfortable infection, escalate into a full-blown, life-threatening medical emergency?
Well, here are the absolute red flags you can never, ever ignore. A high fever with chills, severe flank pain, and persistent vomiting. These are all screaming that your kidneys are under attack. But we also have to watch out for cognitive signs. In clinical cases involving older adults, for example, they might not present with that typical burning or back pain at all. Actually, sometimes a sudden onset of confusion or an altered mental state is the primary sign of a severe kidney infection or early sepsis. It requires immediate, drop-everything attention.
We also have to highlight the unique risks during pregnancy. An untreated UTI or a suspected kidney infection in a pregnant woman isn't just uncomfortable. It directly increases the risk of preterm birth and low birth weight. This is a scenario that requires immediate hospital management to protect both the mom and the baby.
All right, we've seen the invasion and the warning signs. Now, Section 4, Diagnosis and Treatment Options, the medical counterattack. How do doctors actually fight back? It all starts with precise diagnostics. Doctors will typically run a urinalysis right away to check for white blood cells, which is a sure sign your immune system is actively fighting something. They'll also order a urine culture. This actually grows and identifies the specific bacteria, so they know exactly which weapon to use against it. And if they suspect the infection is spread further, they'll use blood tests or even ultrasound and CT scans to look for structural damage or blockages like kidney stones.
Now, what's really interesting about this next point is that we get to bust a massive myth. We've all heard that cranberry juice cures a UTI, right? Well, let's set the record straight. Medical antibiotics are the primary, evidence-based treatment to actually eliminate a bacterial infection. Cranberry products might help reduce recurrent UTIs in some people by making it a bit harder for bacteria to stick to the bladder walls. But honestly, the evidence is pretty mixed, and they absolutely cannot substitute for antibiotics if you have an active infection. No way.
So the treatment protocol relies heavily on those antibiotics. For a standard, uncomplicated UTI, oral antibiotics usually do the trick perfectly. For severe kidney infections or sepsis, intravenous or IV antibiotics are required in a hospital setting. Doctors will also recommend specific pain relief and, of course, plenty of hydration to help flush the system. But the most important thing here, you have to complete the entire prescribed course of antibiotics, even if you feel 100% better after 2 days. Stopping early is literally how bacteria survive, mutate, and build antibiotic resistance. You gotta finish the whole shebang.
Okay, infection cleared. Let's move into our final section. Section 5, Prevention and Future Health, Maintaining Your Defenses. It's time to focus on empowering you with some actionable, everyday steps.
Preventing a UTI is all about supporting your body's natural flushing mechanism. Drink plenty of water every single day. When you feel the need to pee, do not hold it. Avoid delaying urination so bacteria just don't have the time to multiply in stagnant urine. Always wipe from front to back to keep digestive bacteria far away from the urethra. Urinate after sexual activity, maintain good overall hygiene, and if you ever feel those early warning signs, get them treated promptly. These simple daily habits are absolute game changers. Now, sometimes recovering your urinary health requires a bit of rehabilitation. I want to clarify right off the bat that physiotherapy is not a treatment for the active bacterial infection itself. However, for certain patients, especially those who have been hospitalized or who struggle with incontinence, pelvic floor exercises like Kegels and functional mobility training are incredible supportive tools to help rebuild healthy bladder habits after the infection is gone.
So the crucial point is really summed up right here. Urinary tract infections are among the most common bacterial infections, but they are highly treatable when diagnosed early. You don't have to be afraid of them. When you understand how they work, recognize the symptoms early, and seek prompt medical care, you are going to be fine. By practicing good daily habits, staying hydrated, and listening to your body's warning signs, you are firmly in control of your lifelong urinary tract health. But it does leave us with a pretty big question to ponder. If bacteria can adapt so quickly to our antibiotics, how will our everyday habits need to evolve in the next decade to keep this natural flushing system secure? Thank you so much for joining me for this explainer, and keep learning.